Good morning, everyone. Today we will be discussing concussion in the workplace and what employer and or occupation health and safety professional needs to know about concussion. Objective for this presentation are demystifying concussion, providing overview, sign and symptoms of concussion, and return to work strategies. So what is concussion? A concussion is a type of traumatic brain injury caused by a direct blow, jolt, or bump to the head, and also known as bell ringer, a ding, or seeing stars. Besides getting hit in the head, concussion also occur getting a blow to the body, which could cause the brain to move rapidly back and forth. Now I would like to show you guys a video of what happens during a concussion.
The brain is protected by the skull and cushioned by cerebrospinal fluid. But a blow to the head can make the brain move around and bang up against the hard bone of the skull. When this happens, it can cause a temporary change in the way the brain works, also known as a concussion. Helmets can help protect the brain from injury, but a person can get a concussion even while wearing a helmet.
Does there have to be a loss of consciousness or amnesia? No, 90% of the cases has no loss of consciousness and may or may not be a loss of memory. The most common symptoms and symptoms are fatigue, forgetfulness, poor concentration, irritability, headache, and poor concentration and balance. Recovery time. Most resolve in a day or two and go away completely in 3 months. However, 10 to 15% of sufferers experience longer than 3 months, and they refer to as a post-concussion syndrome. The employee experience invisibility of injury, fear and loss of their job, being pressured to continue work. This could be by employer or by coworkers. Lack of information or guidance to return to work. So what the data shows, in Canada, approximately 450 people acquire brain injury every day. That is an average of 1 in every 3 minutes, or 165,000 injuries a year. It's leading cause of death or disability for Canadian under age of 40. Some stats about concussion amongst workers in Ontario. 7.3% worker-related concussion in Ontario. And as you guys can see the data, it's going up from 790 claims in 1996 to going up to 1644 claims in 2012. And it's already, a wave's already coming and it's going up, and we have a shortage of frontline help. Here's some more statistic. In 2013, in Ontario, 80% traumatic brain injury filed to WSIB, where concussion were 50% per year in 2010. And statistic revealed that 371% in Ontario from 2004 to 2013. This is the rise from this number from 2004 to 2013. What industries are most in risk? Fishing industries, mining, transportation, and the most injuries occur in sale and retail. Preventing concussion and workplace. Removing trip hazards from walkways and workspaces. Use proper signage to alert employee or to clean the wet surfaces. Keep shelf and storage area and your workspace clean and organized to avoid falling objects. If the job requires helmet, make sure the helmet fit properly and in good condition. If the worker has a concussion symptoms, should alert the supervisor immediately and seek medical attention. Someone with suspected concussion should not be left alone, and only return to work when advised by a health professional. Create an incident report as soon as the employee is safe. Call or tell the Joint Health Safety Committee or Health Safety Representative and the union about the incidents. Notify the Ministry of Labor, Training and Skill Development within 48 hours of the incident. So gradual return to work process. When the employee is ready to return to work, it should be gradual process. Try to accommodate the employee working with their physician as far as their restrictions are concerned. Physical job to sedentary desk work, and gradual increase amount of work hour per day or week. Now I would like to show you guys from North Oak Chiropractic Neurology, Dr. Jay Burness, speaking about return to work strategies.
Hi, I'm Dr. Jay Burness. One of the questions I often get asked by new PCS patients is whether or not they should still be working. While about 9 out of 10 of my patients I see are on disability or they're students who can't attend school, the other 10% are still trying to continue with their work lives despite their symptoms. The question I always ask them is, do your symptoms get worse while you're working? If so, then based on my experience, you really shouldn't be working. If your work is aggravating your symptoms, it means that you're pushing your injured brain pathways to the point of failure. Doing so does not make them stronger and can actually injure them further. These patients will often say that they crash after working and they have to go home and sleep for several hours to recover. Depending on the type of work you do, it may still be possible to work with some modifications. Most PCS patients are light and screen sensitive, so working on a computer will aggravate their symptoms. Sometimes it's just the light or the flicker of the screen, but most of the time it's a combination of the light and the fact that their brain injury does not allow their eyes to work well enough to track the characters that they're looking at. Scrolling up and down on a computer can be especially difficult for PCS patients. If you are trying to work with a brain injury, it's very important that you don't push yourself to the point of symptoms. So you need to be systematic about what you're doing. If you're working on a computer, you need to time how long it takes before your symptoms come on. This is your baseline time to fatigue. Obviously, if that time is only a few minutes, then you really shouldn't be working at all. But if it's a number of hours, then maybe you can work limited or reduced hours. And then there's coping tools like green filters and glasses, earplugs. These things might lengthen your time to fatigue. So going forward from there, try to work only within that time limit. After a week or so, try to push past that time and see when the symptoms develop. This will be your new time to fatigue. And then by sneaking it up a little bit every few days, over time, if your injury isn't too severe, you may find that you're getting stronger and that you can work for longer. But if you hit a wall, you hit a time that you just cannot work past without getting symptomatic, then it may be that your injury is just too severe for this approach. You will need to see somebody to help you work through this problem. And my recommendation, of course, would be a functional neuro. Understand that working things this way, trying to push your time forward at work, is really not correcting the problem. All it's really doing is building a compensation so that you can increase your endurance to work with your problem. In my mind, it's always better to try and fix these things than to try and build a compensation to them, because ultimately you'll get into a situation where that compensation will fail. So to summarize, should you be working if you have PCS? In my opinion, no, you should not be working. If you're going to try to work, do not push yourself to the point of symptoms. You're only going to drag your problem out even longer, and potentially you could make it worse. So I hope that's been helpful. I'm Dr. Jay Burness. Thanks for watching.
So in conclusion, the three primary ways to keep the workplace safe is to identify the risk, avoid the risk, and reduce and eliminate the risk. And here are some references for all my work, and if you guys would like to get more information, please look at the reference. Thank you.